In this video, we're going to look at a paper we published in the World Journal of Urology, looking at a combination of demographic and blood test data to determine an AI-based score about whether a patient is likely to have prostate cancer. This paper was published in a collaboration between the team at Maxwell Plus and external urologists, including lead author Marlon Pereira, who's currently a urologist based in New York. This work was published in mid-2020 and shows one of the many AI models that are present within Maxwell Plus. Now, before we get started, a few terms relevant to the work within this publication. Number one is naturally going to be Free-PSA. Now, what is Free-PSA? PSA is the prostate-specific antigen. It's an antigen produced within the prostate which can enter the bloodstream for a number of different reasons, including cancer. Now, this antigen can come in two different forms. It can come bound to other proteins, so connected to other proteins, or it can come on its own. When PSA is on its own, that's known as Free-PSA. And it's looked at in combination with total PSA as an additional clinical marker that can be used during diagnosis. The second term here is a performance indicator of machine learning models, specifically classification models, and that's the AUC. The AUC is an acronym for area under the curve, and specifically the receiver operating characteristic curve. This number represents how well a given model classifies examples that it sees, in this case as prostate cancer or not prostate cancer, with the ideal score being a score of 1, and a classifier which does as well as a random test would get a score of 0.5. Now let's get into the work. Within this model, we looked at a combination of demographic and blood test data from a number of different clinical sources to train a classification model. Now, this work looked at a number of patients from two data sets: the PLCO, a large screening study undertaken in the US, and an internal data set of Australian patients that was roughly the same size as the subset of the PLCO database who underwent Free-PSA. After some filtering, there were 4,500 patients which fit into the categorization for this study. We excluded patients with a PSA above 10 because we felt that under most circumstances those patients would automatically progress to further testing and were irrelevant in this scenario. As with many machine learning problems, we split the cohort into a training and testing set and an 80-20 split, which allowed 3,600 patients to be used for training and a further 9,010 to be used for testing. Now, we trained this model, which was a multi-layer dense neural network, to predict whether the patient was likely to have cancer if we were to biopsy them within the next 12 months. This particular model did not differentiate between low-grade and high-grade cancer, but more recent versions that have been incorporated into the Maxwell Plus program did make that differentiation. You can see here in figure 2 that the machine learning model outperformed both the PSA and the free to total ratio in terms of classifying patients as cancerous or non-cancerous. If we look further down the paper, we see that in terms of the AUC, that metric we discussed before, the model outperformed free to total ratio, Free-PSA, age, and PSA as individual clinical markers. What this showed was that these models could provide superior differentiation of patients into high and low risk. And to give you the context about how this model is used within Maxwell Plus, we use this model to determine whether a patient should go on for further testing. Typically, Free-PSA is done as a follow-up blood test for patients with an initially elevated or high-risk PSA. And this model, in combination with the Free-PSA and free-to-total ratio, can then be used to inform whether further testing again is required for this patient. Hope you enjoyed this video. get a little bit more of an understanding about some of the many pieces of research and AI that are in use at Maxwell Plus. And next time, we'll continue to go through other publications that form the wider picture of research and clinical output here at Maxwell Plus. Thanks so much.